Hello everyone, and welcome to this very special broadcast event today, brought to you by Censis Technologies. I'm your host, Tyler Kern. Thank you so much for joining me. Today's event is really exciting because we're talking to two people who do amazing work at VA hospitals in the United States and who also work with Censis as Service Plus customers. And so we're thrilled to have Alina Easley and Jarvis Smith joining us here on the broadcast today. Alina is the Census Track Coordinator at Temple Veterans Affairs Hospital, and Jarvis is the Assistant Section Chief at Malcolm Randall VA Hospital in Gainesville, Florida. And we're also joined by Kelly Swails, the Director of Clinical Services at Censis Technologies. And we had a great conversation right before Christmas that we're going to play for you, where we discussed some of the challenges that each of these people have had over the last year as SPD leaders and the solutions they were able to find. And so after that, we'll also be taking your live questions. And so make sure to put as many questions or comments that you have for our panelists in the comment section as we go along. We'll be back to answer those as soon as our pre-recorded conversation is over. So without further ado, let's get to our featured conversation today with Kelly, Alina, and Jarvis right now. Hello everyone, and welcome to our live conversation today, brought to you by Censis Technologies. I'm your host, Tyler Kern. Thanks so much for joining us for this conversation. We are really excited to have you along. Today on the broadcast, we're going to be discussing some of the challenges faced by hospitals over the last year and how they were able to overcome some of those challenges as well and leverage some of their partners in doing so. So we have a really exciting conversation coming up for you. I want to introduce our panel of guests here for you today. First, we have Kelly Swails. She's the Director of Clinical Services at Censis Technologies.
Thank you for having me.
Absolutely, and we're also thrilled to be joined today by Alina Easley. She is the Census Track Coordinator at Temple Veterans Affairs Hospital. Alina, thank you so much for joining us.
Thank you for having me.
Absolutely, and last but not least, we have Jarvis Smith. He's an Assistant Section Chief for Malcolm Randall Gainesville Hospital as well.
I'm glad to be here, thank you also.
Absolutely. So Alina and Jarvis, with you coming kind of from outside the census area, tell us a little bit about yourselves. I'd love to get to know you first and foremost. So Alina, why don't you kick us off and tell us a little bit about your background and your role where you're working right now.
Once again, hi, my name is Alina Easley. I am the Census Track Coordinator for Central Texas Veteran Healthcare Center. I have been with the facility for 8 years, in this position for 3 years. Before I began my career as a MST, I actually was a dental assistant for various years, and I am currently pursuing my degree in information technology.
Excellent stuff. And Jarvis, tell us a little bit about yourself as well and your current role.
Okay, how you doing, everyone? My name is Jarvis Smith, and I'm the Assistant Section Chief of Sterile Processing here at the Malcolm Randall VA, Gainesville, Florida. I've been in SPS sterile processing for 14 years. I started out as my background, I was in the Marines and then doing logistics, and my background from logistics came over into the VA side as I came in as a supervisor, inventory management at SPS, and I've been 14 years I've been doing the job, and in my current role as Assistant Section Chief, I've been doing it for 7 years now. And I'm responsible for the operations, for the day-to-day operations of the sterile processing here.
Very excellent stuff. So you're both excellent people to talk to just about what's been going on over the last year and the way that you've been able to solve some of the challenges and hurdles that you've come up against. And so as SPD leaders, can you describe some of the challenges that you face in your roles managing your departments and its operations? So Jarvis, tell us a little bit about that and some of the challenges that you faced in your role this past year.
This past year, because we're still in a pandemic, some of the biggest challenging is staffing, number one, and having enough staff to do the work. Also keeping your staff healthy and following the protocols, because we had several instances where we lost staff due to COVID, and where we were down numbers, and having to adjust to the needs of your customers. The OR, one day we was maybe doing, at 1 week we had 50% that we're doing, and the next week, because of the numbers and how things are changing, we may be at 90%. So just trying to keep my team focused and trying to make sure that everyone know the task at hand, and trying to overcome our barriers. We had staffing issues, we had PPE issues where we had things on national back orders. Just and keeping everyone grounded and understanding the mission of what we have to do in our roles, and providing a good product for the patient.
Absolutely. And Alina, same thing. What sorts of challenges did you come up against in 2021 with your role and what you do there with Temple Veterans Affairs Hospital?
I would have to agree with Mr. Smith. We also ran into a lot of milestones with staffing and being short staffed and people being detailed out. It really put a strain on the staff as far as compliance in various areas, as well as being able to implement new areas utilizing CensiTrack. It was a little bit of a struggle because, our percentage of clinical procedures went down. So therefore, a lot of the staff was not there. So a lot of things that we had projected out to accomplish was not able to meet those time frames, those goals.
Absolutely. So tell us a little bit about how disruptive those challenges were to what your objectives and goals were, as a group and for your departments. Alina, tell us a little bit more about that and why that disruption maybe caused some struggles for you.
So for instance, were the procedures going down, the clinical procedures going down, the clinical staff was detailed to the COVID floor. Therefore, we didn't have any staff there, so we couldn't implement case tracking in various places. For instance, our ENT, we had projected them to be implemented at the beginning of this new physical year, but we were able to do that because a lot of staff was detailed out. As far as compliance as well, for the OR, we started running into issues with the OR not being as compliant with their post-case tracking scanning because they said that they didn't have the staff, they didn't have the time, they were overworked. So things of that sort, we saw some trends with our reports that we were declining in. So, but we were able to overcome those though with coming back up.
That's fantastic. And we'll talk a little bit more about that here in just a moment. But Jarvis, tell us a little bit about that from your perspective as well, how these challenges maybe disrupted goals and objectives that you had for this year.
Some of the same issues that Alina had was that we trying to balance the workload with the staffing because a lot of the clinical staff in the OR and some of our other customers was detailed to the COVID floor and whatnot. Just trying to, one of the big things that we were trying to do this year was to take, for GI Lab, we wanted to have them start using CensiTrack to start posting their the pre-cleaning times of the scopes. So that kind of delayed the process of us moving forward with that we're finally now getting to that point where we able to have the GI Lab use CensiTrack. So some of the things that we wanted to do with CensiTrack, we wasn't able to do it because we just had to delay it because of, everybody, staffing shortages hit everyone. We had not just SPS throughout the whole entire facility. So we just had to adjust to whatever the needs of the customers to make things happen.
And Kelly, is this somewhat consistent with what you've seen just from different hospitals across the country, just that staffing shortages and things like that really limited their ability to do certain things?
Yes, and so I've been going to hospitals over the U.S., Canada, Puerto Rico, doing clinical assessments on their utilization of CensiTrack. And it is a common occurrence that I'm seeing. Staffing is probably the number one issue. And so one of my main things that I do is really work with customers and kind of identify some areas of where can you maybe alleviate some of that work they have to do. And my number one recommendation is always start doing quality audits on your documentation. And then when you're doing quality audits and your documentation is complete, then you can get away from paper documentation. So for example, I was at a customer in October and he had worked the night shift just to kind of, this was a manager, just to kind of see how the flow goes. And he said, yeah, I documented everything in CensiTrack. Then I went over and documented on paper all the Bowie Dix, the wash test, everything that first loads of the day. And he said, I literally sat for an hour and did all that work. And then I think of the rest of the day, everyone had to document. And he said, we have to get away from paper. We have to go complete electronic because look at that huge time saver. And I said, well, what better time than the present, especially when you're short staffed. So if they don't have to be doing that paper, then look at the time they're going to save and you'll be able to get more done.
So Jarvis, hearing that, obviously, have you seen the benefit at times this year of being able to leverage technology to help fill some of those gaps that you've experienced when it comes to being short-staffed in certain ways?
Oh, yes. I mean, the documentation part was huge for us in Gainesville this year. We actually went live on the electronic documentation in CensusTrack in October. So for us, it was a game changer for us not having to document all that paperwork. We was able to do it in CensusTrack. Staff was happy with it. They were more efficient. So definitely using technology, CensusTrack, that helps us out every day when we trending, when we looking at things that customers usage, what we need, our priorities, because right now in this pandemic, we are really big on prioritizing our work and getting exactly what the customer needs because of the staffing shortages and different things.
And then Alina, from your perspective, tell us a little bit about the avenues that you took to help overcome the challenges that you were explaining earlier and how you leveraged clinically trained experts to help address some of the issues that you had.
So what we did was we had to take a step back and look at what was a priority as far as implementing. When our clinical staff came back to their area, we met with leadership and we actually talked to them and asked them, is this going to be feasible for you all to begin this new phase of utilizing CensusTrack, because it is new for that particular clinical area, which we were able to do it in phases. For instance, our dental facility, our dental clinic, they're actually our largest service outside of the OR. So what we did was, instead of implementing them entirely at once, we did it in phases. So that's how we were able to overcome some of our challenges. We weren't able to implement all at once. We just had to do it in phases. And we were actually able to implement just about every single clinic that we did project out to do. We were able to implement just about every single one except one. So, yeah.
That's incredible. That's incredible. So, Kelly, when you hear about the challenges that people like Kelly, that Alina and Jarvis faced over the year, when you hear about those challenges, how do you help them, and how do you come in and maybe take the approach of hearing what their issues are and knowing how CensusTrack is going to be able to solve them? How do you have those conversations and come in and help meet the needs that people are having?
Yep. So one of the main things, you also have to keep in mind you're being compliant. So you always want to make sure you're compliant, make sure you do everything as you're supposed to. You want to keep your patients safe. You want to be compliant with your Joint Commission, AMI, ARN standards. And so many times I see when you're short-staffed and people are rushing or hurrying, some of that things will get missed. So as I mentioned earlier, doing those quality checks, making sure everything is complete. And then doing the things that you can. Jarvis, you mentioned that you got the endoscopy center to start documenting that bedside clean. That is a phenomenal way for them to know when that scope had the pre-clean. Because now when you get it into the decontam endoscopy area, you can then look right in CensusTrack and it tells me when that scope is pre-cleaned. So do I have to do delayed processing or can I do my routine? That can be a huge, huge, huge time saver. And so there's little things that if everybody works together and we can get more done and more quality work done in lesser time. And it's simply a few clicks of a button. It's amazing the things that you can get documented.
Absolutely, absolutely. So, Alina, now knowing this heading into 2022, how do you feel like you're going to be able to grow and move forward as a result of maybe improved processes and things like that?
I think that we're going to be able to grow because the other clinics, the services that is utilizing CensusTrack, they actually have grown to love it. So word of mouth is spreading, and so they're like, "This is awesome. We can do, quality feedback on SPS. When are we getting implemented?" So I think just integrating with other services has really helped growing the team aspect and collaborating together. So I really think it's going to help us continue to grow our outside users with CensusTrack.
Yeah, and Jarvis, same question. How do you feel like this will be able to continue to grow and move forward as you, improve processes and are able to be more efficient?
Same thing, just trying to grow it to your, outside customers to use it. For scanning, we try to get the more scanning in the OR in our other clinics and things that they can feel comfortable with CensusTrack to actually scan, so we can track everything, so we can, make sure that things we can find it is in the correct location. And, and just my team growing, we're trying to get to the level of where we have everybody is a CensusTrack super user, that staff understands it, that they can go in there and pull reports or they can pull their productivity and understand things, our mission and where we're trying to go using CensusTrack, because We're doing a lot more of the task efficiency, scanning those type of things. So we're just trying to just get our staff to understand that this is the system that we're using, and this is so they can understand it, and that that everybody's successful doing their job with using CensiTrack.
And Jarvis, can you tell us a little bit about maybe the implementation process? Was that a difficult process to walk through? Just kind of talk us through that aspect of it as well.
With CensiTrack, well, we've had CensiTrack for a long time in Gainesville. Long time. I think for us, the Gainesville biggest issue was evolving with CensiTrack, because we had it for years. You know, I started in 2008 here, and they had it before then. So just us trying to evolve with all the new modules and like Scope Track. We're just starting Scope Track in this year also as Track and Scope. So it was just, for us, it's like once we get the training, which is some of the services that you guys provide, where you guys come on site and train us. And once we get that training and come up with a flow and come up with a process, we implementation, we start off with our supervisors understanding, our lead techs understand, and then once the key people understand, then with the staff is usually we flow right into it. And we do a lot of training, a lot of hands-on. We use CensiTrack, our client manager, and all those guys that's available to us to ask questions that help us able to implement different modules and things that we want to use in CensiTrack.
And Kelly, I guess that raises a good point that some people are going to be legacy users and have been using it for a long time, and other people have been using CensiTrack for a short period of time, right? And there are positives to both of those.
Correct. And even when you look at, so Jarvis has had it for many years, he's had CensiTrack for many years, but yet you always have new staff coming through. So while you can look at this and go, oh, yep, we all know how to use it, but those new staff that are coming through may not. Or even with someone that does use it, maybe they're not using it to its full potential, or they're leaving off a little portion of how they're using it. And so that's kind of one of the benefits is, let's look at your account, let's go through this, and then see where we can help you to maximize your usage.
Yeah, that's an excellent point. And Alina, tell us a little bit about that from your perspective. Are you more of on the new adoption side, or has CensiTrack been around for a long time in Temple?
We've been utilizing CensiTrack since 2017, but we were not using it at its full capacity or potential until I actually took over this position, and we received those business reviews, and we saw areas that we needed to begin to utilize. So those business reviews really helped us see, okay, we need to start using this. This is the way that we can use this. So I would say that is wonderful for them to come out and grade your site and tell you what you need to grow and areas of improvement in. Actually, Kelly came out and she actually taught me how to do compliance reports that I had no idea on how to do, which really helped us clean up our data as far as making sure that people are passing out the loads into its entirety, making sure that we have people deleted out of the system that is not utilizing the system or suspending their accounts. So it really helps you as a facility clean up your stuff and get better.
Yeah, that's an excellent point. And I suppose, Kelly, that's an important aspect of what you do as well, just taking that hands-on consultative approach to make sure that people are able to use the platform to the fullest of its extent, because that's a good way to help make sure that everyone is enjoying the experience as well.
Right. Yep. And so with Jarvis's facility and the 4 sister hospitals there, I've done their assessments the last 3 years. Coming up beginning 2020, it'll be my 4th year doing their assessments. And it's nice working with them through the years, because you can't just go in and say, yep, here's everything, here you go. Sometimes it's baby steps. Don't want to do information overload. You have to get that staff compliance. So it's one thing to say, hey, let's do this. Really think you should be doing this. To be compliant, you have to do this. But then it's getting the staff to do it and that follow through. So it's nice working with the same customers year after year, doing their assessments and that training, so then we can get all that done and have you perfect, as I say. Because in sterile processing, it has to be perfect documentation.
It's an excellent point. Well, it's been great getting a chance to hear you from your perspectives, hear some of the challenges that you've had over the last year or so, especially as it relates to SPD. And so it's been interesting just getting a chance to learn about those challenges and also how you overcame them, and the way that you're each utilizing CensiTrac at your facilities, I think is really fantastic. And so I'd love to get final thoughts from each of you here before we sign off today. Jarvis, let's start with you. Just any final thoughts, anything that you want our viewers and listeners to walk away with here today after watching the broadcast, or any just summary statements that you'd like to make just about what we've talked about here today. So the floor is yours just for any final comments.
SPS, I said SPS is the heartbeat of any facility or hospital system. That the main thing about SPS is that even with our barriers and things that we have to face, that we have to get it right and we have to overcome. And for the most part, our staff are resilient, and they get it done, and they come through and make sure it's done right, and they understand that it's a patient at the end of their product, and our job is to put out a good product every day.
Excellent stuff. Absolutely. And Alina, any final thoughts? Anything you want to leave our viewers with here today?
Yes, I just want to leave everybody with, Mr. Smith said, I understand that we're in a pandemic. I understand that everybody has to be very flexible. But as he stated, we are resilient and we will overcome. And we're just going to continue to put that patient first.
100%. And Kelly, wrap us up here today with any final thoughts on what we've discussed here today, and anything you want the viewers to walk away with.
Yeah, I think, they mentioned you've mentioned it's been a challenging year for all of us. And it's kind of that we all need to come together. We all need to do what we have to do to keep our patients safe, to keep ourselves safe, as well as get everything done in time. It's always quality over quantity. We know that can be a little challenging, but any way you can maximize your usage of CensiTrac so that way you can make things easier, I highly recommend doing it. Reach out to your client manager, reach out to myself for assistance. So we're always a phone call, email away, and we can assist everyone and anyone so that way you can maximize that use and be a little more efficient and and be compliant.
Fantastic stuff. Thank you so much to all three of you for joining us today. Kelly Swails, Alina Easley, and Jarvis Smith. It's been a pleasure having you on this live broadcast with us here today to talk a little bit more about the challenges that you faced this year and then how you've been able to overcome them. It's been a pleasure having this conversation with you.
Same here. Thank you.
Thank you. It's been my pleasure.
Hello everyone, and welcome to the live Q&A portion now of the broadcast. Thrilled to have you along with us still. So we are going to go through some commonly asked questions, some FAQs, if you will, starting off with Alina and Jarvis. And so Alina and Jarvis, what was the biggest thing that your SPD accomplished in 2021? Alina, why don't you go first? Do you have anything that your SPD accomplished in 2021 that you think is the biggest thing that they did?
I'm sorry about that. Can you all hear me?
Good to go.
Okay, so our biggest accomplishment in 2021 was we had a big marking project that Censis actually did for us. We got all of our instrumentation marked at our Temple, Austin, and Waco facilities. And so we are now scanning at the instrument level. So that was a huge milestone for us. So that's wonderful.
Excellent stuff. Jarvis, what about you? What was your biggest SPD accomplishment in 2021?
For us, we go on electronic documentation, and also the implementation of the CensiTrac part of LonaLink was huge for us. Gainesville, out of our 5 facilities, we were the only ones that wasn't doing the electronic documentation in CensiTrac, and currently as of October, we've been doing electronic documentation.
Excellent. So in addition to what you guys just described, so what are some of the maybe challenges that you still struggle with other than staffing? Obviously staffing is going to remain a challenge, but for you guys, Alina and Jarvis, what are some of the other challenges that still exist right now as we have now entered into 2022? Alina?
I would say our biggest challenge that we are experiencing is scanning compliance. The staff knows how to scan, but just them being compliant with scanning back to sterile storage areas or just missing scans for here and there is very important for, to do all the scanning appropriately. But we are kind of struggling with that. We're missing it in key areas. So just being compliant and consistent with the scanning.
Yeah, that's a really, really good point to raise. Alina, what about you, Jarvis?
I would say the same. It's only is going to be as good as the information you putting in there. So making sure that staffing and scanning properly, and scanning in the correct sequence and things like that, so you can pull that information out of SensorTrack is one of the biggest challenges we still have.
So, Jarvis, we got a question from the audience, from Billy in the audience, and he asks, is your facility utilizing the competency module? Can you speak to that?
Not currently. There's been discussion about it, but that's something that management hasn't made a decision on whether we're going to go down that route or not. But we're currently doing them the way we've been doing them, competencies, paper competencies. But we have had discussions about using SensorTrack for competencies.
Excellent. Thank you for answering that question. Kelly, let's pivot over to you. Tell us, what services does the Censis clinical team offer?
Yep. So we offer on-site utilization assessments and training. Along with that, there's data services, market engagements. We also offer SensorTrack Essentials for Management. That is a monthly virtual training event that we offer for our customers so that they can learn the A to Z of SensorTrack, as well as, we're a phone call, email away. So we're always here to ask any or answer any questions that you may have to help keep everyone compliant. Because we're keeping up on standards, changing and updating, and then relay that down to our Censis team so that we make sure SensorTrack can help them help everyone be compliant. And kind of with what they were saying previously about, compliance with scanning, it's kind of where I say, make sure we're doing those quality audits, because those quality audits are going to help you identify where the scanning is not happening or where that documentation is not happening. And then with that, if you're doing it, the day of, who was working in sterilization, so who to go directly to, and then have a conversation with them and say, hey, I looked at this load, you didn't scan into storage, so it's still sitting in the sterilizer. Just a reminder, need you to scan everything that comes out of that sterilizer.
And that provides a little bit more accountability, right? Which is good for everyone in an organization.
Mm-hmm.
Yes.
Absolutely. So, Kelly, tell us a little bit more about what some of the common pain points that Censis can help address in a sterile processing department. Tell us a little bit about some of those pain points that Censis really helps with.
Yep. So I think compliance is number one. Many times I go on site and I see that they have a cart washer, they're not running a wash test. So we'll address that. AMI standards, ST79 clearly states you need to check that daily, every day that it's used. So I help customers get that up to speed so that they're using that and they're documenting that. Along with that is documenting loads that they don't process a biological in. Sometimes they just leave it and they need to be going in and documenting NA because they didn't have a biological, as well as their complete documentation of process loads. That's that pass fail, the cycle, if it's steam, there's parameters. Those are probably some of the main ones that I'm seeing. And then along with that, just keeping your database clean, looking at your users, looking at your access levels, looking at your container comments. So if I'm in decontam, I get a certain pop-up telling me with special instructions. If I'm in assembly, there's special instructions. So just kind of that overall, your whole database of keeping everything clean, accurate, and up to date.
Good stuff. Excellent stuff, and a great explanation there. We appreciate that very much. So, Alina and Jarvis, tell us a little bit about, we just hit 2022. It's a big time for goal setting. Tell us what your biggest goals are for 2022. Jarvis, why don't you kick us off?
I think for us, just getting better at staff using SensorTrack and building their understanding of SensorTrack. And I do know that another big thing of that we're talking about is staff retention, things like that. It's always about the staffing because you want to make sure they have what they need and that they're happy and that we gotta, that we can get the job done.
Certainly. That's a great goal for 2022. Alina, what about you?
Our biggest goal is going paperless, implementing the competency module, as well as doing interfaces with the machines. We would love to do that. So that's our goal for this upcoming year. Well, this year currently.
So we've talked a lot about challenges and things that you want to do better and goals and that sort of thing. But what are some things that your SPD does well that others could replicate? Where do you want maybe other people to learn from what you guys are doing well right now? Jarvis, speak to that for me.
When you ask me that question, I would say we do everything well. But no, it's I think just using it, we have very good processes here, and I think that we look at CensusTrack and we use CensusTrack and we try to make sure that our way of scanning and our processes match, and that that anybody can pull the information, or anybody that walks in, that they can understand how our processes flow, and we able to have that that data to match that so they can understand it. So it's for us, we vary by processes and education that they understand in the processing.
And Alina, what about you? What are some things that your SPD does well that others could learn from and replicate?
I would say kind of what Jarvis said, a little bit of our processes. The whole entire workflow that we have with CensusTrack is wonderful, as well as our case tracking. Having other clinical areas utilizing that, I feel like a lot of people could come and view us how we have a lot of our clinical area utilizing case tracking. So I think that could be something that people could look at.
That's some excellent advice from the two of you there on that question. So Kelly, let's pivot back over to you. Can you share any success stories of utilizing Census's, clinical services and that sort of thing? Do you have any examples and other success stories outside of Alina and Jarvis that you can share with us here today?
Yeah, I, was recently at a customer and they were not scanning in decontam at all, and didn't know that they had to. So while I was just I was on site for the assessment, kind of went through the whole process. Didn't want them to wait until our trainer came on site in a few weeks. I thought, let me show them now how they can do this. And so right then and there, we turned on their computers, got their scanners going, showed them how quick it was to click on that decontam module and then scan everything into it. Now they're able to document that container was cleaned, empty that case card of those peel packs, and then along with that, they're able to see any cleaning instructions. So that was a huge win. Because when you looked at their container history, they had no documentation showing that those containers were ever cleaned. And as you know, if you didn't document it, it didn't happen. So nice to see that you've got that, that you're compliant and that you have that documentation complete.
That's a great story, and I think a great example there, Kelly. So thank you for sharing that. We have a question from the audience, and Kelly, I think you're probably the best person to take this. Peter asks, can Census document the cleaning of a flexible scope using an ATP tester? Can you speak to that, Kelly?
Yes. So the way how our Scope Track Advanced is set up is if you're using ATP testing and it's a number, then in those cleaning steps, you document that it's an ATP or, residue, and so then it's going to read it. So you'd enter in that number if it's 5 or 15, and same then if it's just a pass or fail type of check, then you would select that option. So then when staff would document it, they document that pass fail. So kind of the behind the scenes of setting that up, it's all customizable, whether it's a ATP test or with a number, or an ATP test with a pass fail.
There you go, Peter. I hope that helps answer your question. Another question here for you, Kelly, is how can we take advantage of Service Plus? If people want to learn more information and learn more about Service Plus, how can they find that info and take advantage of that offering?
Yep. So they can go to our website, censis.com, CENSIS.com, or they can call our help desk, and that number is 888-877-3010. And they can also reach out to their client manager. So if you're a current customer, contact your client manager. They can provide information to you. They can connect you with me. If you just have questions for me about Service Plus and to learn more about that, And if you're not a customer, there again, go to the censis.com website or call that phone number, and we'll get you connected with someone to learn more about SensorTrack, LoanerLink, ScopeTrack Advance, all the other products that we offer.
Excellent stuff. So that was a really great answer, Kelly. And so I encourage everyone, if you do want more information, to follow the steps that Kelly has outlined there. So also, Alina and Jarvis, how has utilizing Censis's clinical team really helped you with the efficiencies in your department? How have you seen Censis really enable your team to be more efficient? Alina, let's kick this to you first.
I would say pointing out our deficiencies and areas that we need to grow in. Before the clinical team came out, I didn't know how to pull a load compliance. So therefore we were surveyed. We could have been hit on those fallouts. But because the clinical team came out and educated me, I was able to educate our staff, which now we are compliant, and I continue to pull those reports to make sure that we stay compliant, as well as the weights. I didn't know that we had an option to put the weights in the system, which is a requirement as well for surveyors. You need to know the weight. So I feel as if them coming out, it really helps you stay compliant with surveyors.
And Jarvis, what about you? How has Censis helped increase efficiencies within your department?
A lot of times it's certain things we're looking for to pull out of SensorTrack, especially the reports module, trying to understand workflow, or, trying to, it's certain things that we want, the information that we want certain information from SensorTrack. So for us, just, them being able to help us, navigate and how to pull the reports, or to get the things that we need, so we can provide the data or whatever we're looking for from SensorTrack to, we may have to turn in a report somewhere, and we use the productivity report to show how much productivity we've been doing to answer some of the action items and things we get back from the Vision or National, so we can answer their questions for them.
Well, Alina and Jarvis, it has been a real pleasure having you on this broadcast with us here today. And so thank you so much for all of your time, sharing your expertise with us, and sharing a little bit more about just the way that Censis has helped improve your operations. And so it has been a pleasure. Thank you both so much for joining us here today.
Thank you.
Thank you very much.
Absolutely. And Kelly, thank you for joining me as well from the Censis side. It's been a pleasure.
Thank you.
Excellent stuff. And everyone out there, thank you for joining us for this broadcast today. We hope you found it informative and educational. It was an absolute pleasure having you all along with us. Make sure to go check your email to learn how to get your CE credit for attending this broadcast today. The keyword is expert. So the keyword is expert. Make sure to go check your email that you registered with for this event today, and you will receive an email to get your CE credit. So make sure to do that for coming and attending this broadcast today. And once again, thank you all so much. We'll be back soon with more content coming to you from Censis. But for this one, for my excellent panelists today, I've been your host, Tyler Kern. Thanks so much for joining us.